Hello, everyone. I hope that you are having a lovely day. This is Dr. Erkeda, and I am here with the amazing Dr. John White. And you know what? I know people are trickling in, and we were just talking about how small of a world it is. We're actually quite local to each other, and I didn't even know. But as you guys chime in, it'd be nice if you could just tell me where you're checking in from. And I'm just going to give you an opportunity to tell us a little bit about yourself.
Yeah, we could have checked in to a coffee shop since we're both in the DMV, the District of Columbia, Maryland, Virginia area. But I'm happy to be with you. As you know, I'm the Chief Medical Officer of WebMD. I'm a practicing physician. I'm also a dad. And I'm someone who is very interested in how do we think about health and healthcare. That's the exciting opportunity we all have right now. And I would say we didn't have that 5 years ago. But now with so much innovation in AI and digital tools and influencers like you, we're really having an ability, if we do it right, to change the health and healthcare paradigm.
I love that because it definitely rings true. For those who may not know, I have a little interesting path where I am trained as a family medicine physician, so go primary care. And now I'm currently working in healthcare in different realms and also healthcare risk management for digital health. But at the very core of everything we do as you enter medicine, you should be thinking about your why. And for most people, your why is the patient. And I think as we are growing in healthcare and the capabilities of doing different things and the different healthcare models that come forward, sometimes we kind of lose like track of the health component of healthcare, and we just think about how we're going to deliver care. So I'd love to know how you think about that frame of framing health and healthcare.
Yeah. I think you're exactly right because you've asked about kind of the depersonalization of health, and what I think part of the challenge is that when we look at these new tools, AI, our wearables, that we don't think about it through the perspective of the patient. And these are just tools, so we should be thinking about how is, say, like an AI scribe, how is that going to help me spend more time with the patient? How is that going to get me from away from being in front of the monitor, writing everything down? How do I use wearables to actually provide patients more personalized care rather than simply just to collect more data and let someone else deal with it? So that's what I think are some of the concerns. There's always a buzzword. Last year it was patient centricity, right? What does that really mean? What I've been saying, my new buzzword is patient driven care, right? The patient's in the driver's seat. So if we think about all these new tools and technologies, how is it from the perspective of the patient? And they should be driving all of this. I don't think we're there yet, to be honest, in terms of this perspective, but that's how I think we can address it.
I completely agree. I think that there are a lot of solutions and people have a lot of ideas, but we're kind of leaving some of the key stakeholders out.
Yeah.
We have the solutions of machine learning, and like you said, there are buzzwords this year. Everywhere you look, the buzzword is AI. AI is not new. Like we've been using it forever, and of course, it's evolving, and it will help us in different ways, and it can help clinicians work at the top of their licenses and do all the things. But how are we thinking about this for the patient, and how can we make it easier for them? I still practice, so some of these platforms are a little different where they may be using things to help improve efficiency or productivity, but the patient notices. Like if you're using a lot of smart phrases and text just to kind of get through and encouraging doctors not to speak to the patients in the way they would typically do, the patients are kind of pushing back and like, okay, stop. Yesterday, a patient told me, okay, like, please stop using these generic texts and like talk to me like a human. And I was like, okay.
See, but I
Like,
think
I want that humanism and that touch. Even if you can't physically
Yeah.
touch them, they still want to
Right.
connect.
Sure. I think part of the challenge is we don't all have shared values. And by that I mean, so say you have an AI tool that, helps with taking notes, right? A manufacturer may say to the healthcare administrators, now you can see more patients during the day, right? Because it's speeding up the visit because you don't have to write so much. Okay. Doctors don't want to see more patients throughout the day. They want to see fewer patients and spend more time. Patients don't want less time. They also want more time, but they also want a treatment plan that's personalized, that's really for them. And that's the challenge in terms of we don't all have the same values that we're sharing in terms of what we want out of the way we provide healthcare and even how we think about health. That's why I always change it from health to healthcare, because health should really all be about prevention and wellness and longevity. And healthcare right now is still very much about, the acute setting in terms of the emergency room, the hospital, and managing chronic diseases after people have already developed the diseases that maybe we might have been able to prevent or at least delay. And that's where, the financial incentives don't focus prevention and wellness. And that's what I mean about the shared values.
You are speaking my language.
Oh,
Like
thank you.
it definitely is a system of, like you said, like we need to put the health and healthcare. We're kind of doing sick care right now, where
Mhm.
we have this problem, we're developing it. There are so many different factors, as I'm sure we'll talk a little bit about in terms of another buzzword, the social determinants of health, which is really just common sense determinants. Like if you don't have money and access to safe neighborhoods and food and all the things, of course you're going to be sicker.
Sure.
So how are we addressing these things in order to help our
Mhm.
patients move forward and prevent things is so important. And I think that's where we honestly should throw all of the technological like funds at,
Mhm.
instead of just the cool shiny products. But then even once you get past that, like you said, doctors don't want to see more patients, and it's not because we're lazy and
Yeah.
all of those. We want to spend more time. We want to impact our patients and help them get better. And of course, tools can help us decrease some of the like administrative
Mhm.
work and all of those kinds of things, but you still want to spend that time. You didn't become a clinician or a doctor, nurse practitioner, or whatever, just to click buttons or
Yeah.
just to
To
like
type
do
all
the
day.
bare,
Yeah.
get them out. It's not an assembly.
Right.
So I think that is very important. And like you said, patients want to be talked to and educated in a
Sure.
specific manner. I know in traditional healthcare, most people just have the generic like printout of a disease in their EMR. They print it out, goes right in the trash when the people leave. So we need to think of different ways to innovate. And WebMD has been a
Mhm.
leader in disseminating reliable health information for patients for years.
Yeah.
Like it's like basically the Google, but
We've been
a more
around
reliable
we've
Google.
been around 27 years. 27 years.
Yes,
That's pretty impressive.
really.
A lot of people have come and gone. Uh, but we have persisted, I think, because we are a trusted source. And the way we provide information is something that we've worked very hard on. Every piece of content on WebMD, if you look at it closely, tells you who reviewed it. And you can hyperlink to that person, and they're a board certified expert. And it also puts the date, because that's relevant too when we think about healthcare. Now, we try to stay up to date on everything, but there's a lot of content there. And when you talk about social determinants of health, now we talk about information as a social determinant. Because if you get the wrong information when it comes to your health, there can be serious consequences. And we've all have seen that as physicians when patients are harmed by misinformation. So it's really something that we take very seriously and really try to provide, consumers with this premise that we say, if you have better information, you're going to have better health. No doubt about it. So how do we help empower you with the best information so you can have the best health? And that's something that we are very focused on.
I love that. What do you consider the most innovative change in how health information is being communicated today?
And I think the pandemic really has accelerated the changes. So, I've been a physician a long time. So I can remember when patients would print up information. We wasted a lot of paper back then, right? And then you hand it to the doctor, and the doctor, what would he or she do? They would just put it to the side and do whatever they want and not even look at it. Now patients come in and they tell you what they think they have. I had a patient the other day said, I think I have costochondritis. Wasn't right. It wasn't a bad idea though, in terms of a differential, but it wasn't quite right. But I like the fact that they're trying to find the best information. And the biggest change is that people want to search content now, but then they want to connect it to care, right? And the pandemic showed us that we can all do lab tests at home. We can all do a telemedicine visit. No one ever really knew what that was. But if you have a suspicious mole on your skin, you don't want to wait 6 months as you have to do in some cities to see a dermatologist. If you can do a telederm appointment right then or the next day, or if you could use an app to help give you some information about that. If you have joint pain, we can arrange for you to see an orthopedist, in a telemedicine visit or perhaps in person the next day. And that's useful to know. I mean, we also, depending upon the state that you live in, if you search signs and symptoms of STDs, we may be able to send you a link so you can go get a lab test. That is so different than what it was, 4 or 5 years ago. But patients' expectations have changed. And I'm glad they have changed, because why should everything be around the doctor's time? It has to also focus on the patient. So that's the biggest change. They're searching content, but now they want to connect it to care, and they want to be the driver of it.
That is so true. And I find that just working in telemedicine, that it not only improves like access, because there are large, long wait times and all of the things, but it kind of helps meet patients where they are. There are some patients who may work at Walmart and may not have the capability of taking off or getting care for their children, and so many other different factors. So it kind of just breaks down some of those barriers, not all, because telemedicine is an add-on to in-person care. It is not a replacement, but it can definitely help move things along and help people get care and catch things a little earlier. We do have a comment that kind of ties to this from Dr. Alicia Peterson. And she is saying that, I'm so glad we have the CMO of WebMD on. When we get to the Q&A part, many patients use WebMD and use this to dictate to their physician their diagnosis and what their care should be. Patients don't know how to contextualize their symptoms, and because they're resistant and become resistant to correction. Sorry, guys. Here's where a little bit of knowledge is applied ignorantly, and it's dangerous. How should patients use WebMD?
Yeah, WebMD is not there to diagnose your condition. And we say that, clearly on the site. It's really for patients to have a more robust discussion with their doctor or their nurse practitioner. I enjoy when, and many of my patients don't know I'm at WebMD, but I like it when they come in talking to me about what their concern is, right? And I saw a patient a couple months ago who said he had pain in his clavicle, and he was saying, I think I might have sarcoid. And, that it wasn't even close. He wasn't the right, age, he wasn't the right gender, he wasn't the right ethnicity, it wasn't the right symptoms. But for whatever reason, that was on his mind, and that was his concern. And I'm glad he expressed it. So I think we have to utilize any of the, sources that people are using for information. WebMD is clearly one of them, but a lot of patients are getting information from TikTok as well. We don't want to dismiss them, and we don't want to talk down to patients either. I mean, there's a reason why we went to medical school, right? We have to provide it, as you said, in context. But patients are looking for information, and they want to empower themselves. So we need to make sure that we get them the right information and do put it into context for them as well.
I agree, because there are so many like last minute, and I'm sure you recognize this too, at the door comments where patients are like, hey, I'm too nervous to ask this, or I forgot, or they're reaching out to you in the portal. So it's great to come and not spend 30 or 40 minutes talking about something you think and address what they also are concerned about, because they're Googling it anyway. They're
That's
on
right.
WebMD.
They're Googling it anyway. Yeah. And when they come in, yeah, they have a concern. So I want them to express it. In some ways, that makes the clinic visit easier in a way, because they really are explicit about what their concern is.
Absolutely.
And
And
I will say, I do want to add, and that's a fair point, but I've also had many patients say to me, when I've been at conferences, that WebMD made them take their health condition seriously. And they went to see the doctor. And it turned out to be something that they needed an intervention for. And if they hadn't Googled it and ended up at WebMD, they may not have gone to the doctor. So, there's lots of good stories there as well. But it's really about, how do we use WebMD, as you pointed out, as a tool to help give people information to, again, discuss with their physician. It's not meant to replace the physician by any means.
absolutely. And that makes a lot of sense, because as we know, patients have different variabilities in terms of their literacy. They may be very well educated. There may be a lawyer or a doctor, and it may not be their field, other things.
Sure.
And they may not necessarily understand the processes or the severity. So there are lots of patients who, I'm sure, come into different clinics, and sometimes doctors may be like, you waited to come in here 6 years for this? But they don't know. And it's okay to have that extra to be able to let them know, like, okay, this is some concerning things, like, go see your doctor. So we have to meet patients where they are. And it's great that there's this tool to help people understand what's going on with their bodies and make informed decisions. And we know that it's been said that 8 out of 10 people have some lower health literacy levels, regardless of their education status. So how can organizations work to address health literacy?
Part of the challenge is we all have, in medicine or whatever profession, your own parlance, right? These words that you use that most people don't. The other day, I said to my wife that I said the refrigerator, there was something malodorous in it. She's like, what's that? And I was like, it has a bad odor. She's like, nobody uses that word. I was like, no, they do. She's like, no, they don't. And we're so used to, in our verbal conversations with patients, that they really don't comprehend what we're saying. And there's a lot of data that suggests that. We also interrupt patients all the time. Lots of data says, in 20, 30 seconds, we've interrupted the patient when they've come in. I think we've made progress in printed materials, because there's a lot of apps and other tools to say, oh, it's 6th grade level or 8th grade level. I think that helps a little bit. But I think in our conversations, which we're focused on with patients, we still use words that they don't understand. And I think that takes some work and practice. Something that I've learned in my training was kind of the talk back strategy, which is you ask patients to tell you what you told them and see if they, in their own words, and see if they understood what you meant. So the challenge is, I'll be honest with you, a lot of people think they're good communicators. They think patients are understanding what they say, and they're not good communicators, and patients aren't understanding it, and they're embarrassed to say that they don't know what you mean. So it takes work. I think on the printed side, you really do have to work with those tools and apps to do. But I'll tell you, the other big issue is it has to be culturally sensitive. You just can't take one article, say on heart disease or high cholesterol, and just translate it into Spanish or translate it into Vietnamese and think a direct translation works, because it doesn't. It has to be culturally sensitive as well. So we need some work there.
Absolutely. And that can open up a whole nother conversation in terms of translators speaking to patients in their native language preferred. Even if they're fluent in English, they may have different understandings of certain things and different nuances, or the way words mean different things. And also, like you said, the delivery. You have to be culturally competent, because the way that someone may interact with the patient or say one thing or try to shake your hands, or it may mean something completely different, or the way that there are certain levels of comfort or respect or engagement with physicians or other team members. There may be differences in the way that patients feel comfortable sharing certain things, like if it's not working, if they don't feel comfortable with a treatment, all of those different things. So it's very important that we address those things. And then, of course, we know that there's the issue of bias. Biases are everywhere, they're inherent, but how do we address these and how do we address them fairly? I know after 2020, with all of the different closer looks at the way that biases are being done, it was so important for us to look at that. And even now, as we're implementing more digital tools and AI, we're going to have to look even further.
I think we need data management tools to help us there. And the reason why I say that is if you ask any patient, if you ask any clinician, any physician, any pharmacist, nurse practitioner, if they're biased, everyone is going to say, no, they're not. Right. So this self-reflection isn't going to work. What I think you need to do is provide them feedback in terms of their data, in terms of how many of women patients are on hyperlipidemia medications meeting certain criteria versus men, how many people of color versus Caucasians. And I think using data management tools, looking at how they prescribe opioids and to whom by disease condition, but also sex, race, age, and ethnicity, and just providing that as feedback. Studies have shown simply providing that feedback changes behavior because we do have these implicit biases. They're implicit, so we don't really recognize them and understand them. And that's where we can use data management tools to help address those biases.
I agree. Like there are so many opportunities for us to dive into that and help to improve health equity and impact that buzzword I keep saying, the social determinants of health. So it'll be very interesting to see how that grows, especially with new policies coming forward. You have a rich background in health policy, and we're starting to see more scrutiny on the advancements of digital health and then even AI. More and more will be coming forth. We know that the government came out with the policy on AI governance, innovation, and risk management, and HHS is coming forward with things and all of the stuff. So there will be more scrutiny.
And we do need a lot more there. since you want to be
preach about this. I agree.
Because what I would say is, and I've worked in the government, as you know, in FDA and CMS, the government tends to be the cops, right? I'm going to go after the bad guys, right? That's not what promotes innovation. What we need, and I hope some listeners will do this, become the Sherpas. Who are those guides that are going to help us use AI responsibly, that are going to help us use digital tools responsibly and address issues of health equity? And here's the term for you that you can take on now is health justice as well. So that's what I think, it's great that the government is putting out these general frameworks, but they have a long way to go in terms of addressing innovation and AI tools and simply having a chief AI officer at an institution. Okay, like that should have been years ago. We need a lot more guidance and leadership. And I think the clinical community, the patient advocacy community can help provide that. But we need to be talking to each other. And that's why I'm so glad you're having, these podcasts and interview sessions.
Absolutely. I couldn't agree more. Like there are a lot of policies coming forth, and in them, they do talk about things that are civil rights impacting or safety impacting, but who's defining that? It's going to take years for all of these things to get a little more clear. And we don't have that time. And like you said, incorporating new roles like chief AI officers, great. But for most of the time, they're just changing the role of one person, the CIO or CTO. They're just giving them a new title. So is it really changing things? Is it really impacting things? So
and too often it's done from the top down, where we really have to be doing it from the bottom up in terms of adopting and utilizing these technologies and resources.
Absolutely. So I love that you mentioned we have to engage our users, whether or not that's the people who are in the front lines caring for the patient or the patients themselves and the patient advocates. We have to bring everyone to the table. So this will be a very interesting landscape. And for those who've been watching my LinkedIn lives and things like that, you know that I've interviewed a few people and we've discussed that, and there'll be more conversations on it. We're even having a live workshop in DC. If you guys are available August 22nd, I'll put it on my page But these are really good things that we'll have to watch as the landscape evolves. Outside of what we just talked about, because those are challenging enough, like transforming healthcare as we know it, what do you think is the most pressing challenge that the healthcare industry faces today?
Without a doubt, it's the issue of burnout. And beforehand, you're like, "Oh, have you done any travel, done any conferences?" I was just at this conference called Health Europe, where Medscape put out a report about burnout and depression. And the studies have also been done globally. Almost 50% of physicians, and it could be nurses and pharmacists, whatever, are depressed or burnout, right? And they felt that way for 2 years. How can you sustain that type of profession with those types of numbers? And when you look at ways to address it, people think, oh, well, they want to be compensated more. That's not in the top 3. That's in the top 5. The first is really about work-life balance, right? People's expectations of work have changed. Whether it's right or wrong, it's different than when I was a physician. And it's probably a good thing to have that balance, to be able to have dinner, with your family or friends. It's the issue of respect and autonomy, right? There's a lot of bureaucratic tasks that we have to do as clinicians. And that contributes to burnout and depression. And it's still such a hierarchical system to get to where we are in terms of our licensure, and then within the healthcare system, how we deliver care. So that's one of the biggest concerns, because what the data also showed are that physicians who are depressed or burnt out feel they provide lower quality care. And, it's about 30% of physicians in Europe over the age of 55 say they're so depressed or burnt out that they're thinking of leaving the profession in 3 years. So what does that do to issues of workforce and wait times to see clinicians? So that's something that we've talked a bit about, but not talking enough about. We see it in the nursing profession as well, and nursing shortages. That's one of the biggest issues that we're not talking about enough.
That is so true, because if you can't care for yourself, how can you care for others? So it's not only happening in Europe, you already know it's happening here, and what our industry is doing to address this, like besides pizza parties, besides
Yeah,
like
it's,
and all of the
it's a
different things.
party at the clinic.
Changing the clip, like here's some pizza, go work,
Yeah.
eat. You won't even get a lunch, but eat it while you're doing your notes.
Yeah.
So it'll be very interesting to see how we evolve, and then how do we adopt, and then on top of that, like as we advocate and change the ways that we are promoting wellness, how can we bridge the generations? Because as things have changed in healthcare in terms of, like you said, when you were a resident was probably a little different than when I was a resident.
Yes.
So there were people when I came in when they changed the work hour restriction. And there were people like, oh, you guys aren't nothing. We used to work 140 hours a week. How do you have the 80-hour gap? Like, you're still going to learn. So now we have these different things where now recently the hospital where I trained at, University of Maryland, the residents have unionized. Like when I was a resident, I didn't even know we could unionize. We ended up doing that when I was at FQHC, but that's a totally different story. But like, will more people do this? Because now the physicians are saying that they're being too lazy and all of that. So how do we get people engaged in wanting to stay in medicine and supporting them so that they can support the patients is so important.
Absolutely.
So I think as we start to think of strategies in terms of how to impact healthcare and technology in terms of productivity, efficiency, seeing the patients, getting the access, we have to have people there to do the work. So we have to think of that alongside that and put it as an important item, and also work to have engagement of employees so that they won't feel like their autonomy is taken away, because there are people who are leaving in droves, and it's not just because of the pandemic. We had a large exodus when the pandemic started, but now people are seeing that there are other opportunities out there. There are things like DPCs and telehealth and all of the different strategies. But like I said, healthcare can only run in the mixed models. It can only survive on telehealth. It can only survive with concierge medicine.
Yeah,
How will we have people to care for our patients if we're not caring for them?
exactly.
My little rant for the day.
We have covered a lot.
And we're coming to the close soon. I have a few more questions. We talked a lot about technology, integration, patient education, preventing burnout. Are there any emerging technologies or innovations that excite you that are coming forth?
Yeah, I'm really excited about how wearables continue to evolve. And I think they're going to get better. They're not medically grade, but it's important to look at trends. So, and this is where I feel the FDA hasn't shown leadership in helping people understand what do you have to be a medical device. Because what I'm really interested in that is that diagnostic capacity. So it's great if a toilet that we all use every day can detect glucose in your urine, which may be a sign of diabetes, or can detect a UTI, or could even detect blood and stool, as a colon cancer screening. I mean, that's amazing technology. It's toothbrushes that can detect strep throat, right? How hard is it when you have kids to have to, go to the doctor or wait for a test? If you could do that at home and then call the doctor, that would be terrific. And we're all used to doing lab tests at home nowadays, after the COVID pandemic. So it's these types of tools and technologies more and more that you can bring healthcare into the home, because that's what really matters. Health happens outside the doctor's office. So those types of technologies and tools are what really excites me.
Those sound exciting to me, like bringing healthcare home. That seems
Yeah.
to be our theme of the day and of the year, because we have to meet our patients where we are. And we know that healthcare is evolving. And like you said, WebMD has been here for almost 30 years. How do you foresee the role of digital health platforms like WebMD evolving over the next decade?
Yeah, I think they continue to become more and more relevant in terms of people are searching for information, right? We're trying to put the patient in charge of their care and drive their care. Well, they need to be empowered with good tools and good information. Think we have to think about AI and the use of generative AI and how that's going to change things. It's not just in text, but it's also in video, which is a little bit scary how you generate video that may not actually be true in terms of what happened. So I think those are exciting tools that we have to figure out how to utilize effectively, how to be transparent about it. But I think it's an exciting time to be involved in providing information to consumers, because information is power at the end of the day. And if we can empower people with good information, that's a terrific thing to do.
At that point, I will let it close. I could not agree more, and I'm so thankful that you were able to take some time and join us on this LinkedIn Live event. I'll just give you an opportunity to tell our listeners goodbye. And for the listeners who are watching, I know it's lunchtime, so you may have been in and out. So this will continue to be live on LinkedIn, on my page, and then I'm also going to post it on our YouTube channel, so you can go back and watch it later, ask us questions.
Well, thank you for having me. It really has been a delight chatting with you, and I look forward to continuing the discussion.
Thank you. Have a great day.